all for being a part of this fantastic day.
So glad y'all could join us.
We've been spending the last 3 days bringing together the worlds of health equity advocates, of health technology startups, and of healthcare professionals.
I've been part of this health equity world for a long time, and we talk a lot about the problems. And what we hope to talk today a little bit more about are the solutions.
I often say that health inequity is America's chronic condition. How can we unravel that from a systemic and structural standpoint?
This is really about social justice. It's really about health justice.
We still have communities that are marginalized, that don't have access. How is it we change the conversation so that we really can bring the level of care that every person, every community needs?
How is data really impacting the health of our communities? What is the potential? What are the gaps?
We need more people who either understand data or think that they need to hire somebody who does, because it's so incredibly important.
Life expectancy is going down. That is unprecedented. So my real question is, what is going on differently that has led to that?
We have a saying at US News, you can't fix what you can't measure.
Let's get a little bit uncomfortable here. You brought up this issue.
I'm a disruptor, so I'm ready to disrupt the civil rights movements, labor movements, women's movements. Were they collecting data? No, it was a collective people who had a sense of urgency and knew their power.
You can't just address the disparities in health outcomes. We have to look at the disparities in our society.
The number one determining factor of your life expectancy is not whether you smoke, not whether you drink. It is your zip code. We have to have more conversations at the table with leadership.
We need to find a way for technology to extend to all populations.
There's a tendency to kind of jump to hyper-complicated solutions when sometimes the easier answer is right in front of us.
All those inequalities have to go back to your value system. Health is not rocket science.
We have to have empathy. We have to have investment, and we have to realize that it's either all of us or none of us that's getting good care.